You actually did a residency in regenerative medicine at the Reorden Clinic.
Yeah.
And tell us a little bit about that and what you took away from, was it 2-3 years?
It was a 1-year residency. It was the first time that this residency has been offered. So our med school, which is now Sonoran University of Health Sciences, used to be Southwest College of Naturopathic Medicine. So when I graduated, it was Southwest. But they were planning on starting this regenerative medicine residency program. And so I was actually the first person to go through it. And so because it was in the beginning stages, the first time they offered it, it was only a 1-year residency. Now it's expanded out into a 2-year residency. There are a few other clinics across the country who have similar regenerative medicine residencies that vary between 1 and 3 years. The one that we currently have in our clinic, like I have a resident under me, his is a 3-year program because we're building it out a little bit more. But that residency was, really, really eye-opening. It was nice because my residency director, so my attending physician, was an anesthesiologist who did interventional pain procedures. So 90% of what we did was we injected spine. So cervical, thoracic, lumbar, sacral, and then just the other peripheral stuff for joints. And all of it was x-ray guided because that's generally standard of care in the allopathic world. It was a high volume clinic because he did work with both insurance and non-insurance patients. So just got a ton of hands-on experience on safely and adequately treating patients predominantly with spine related issues. And then because of my personal history with back pain, that's really where my deep dive into, treating lumbar pathology really came in, was my experience layered on top of the fact that probably 65% of the patients we saw had low back pain and we were treating them for that. And so learned a lot of the conventional based stuff and did a lot of the conventional based stuff with that. But then also it was a great clinic in the sense that we had the ability to offer PRP, prolotherapy, bone marrow, and that type of stuff, the regenerative stuff for the patients who were sick and tired of doing the steroids and the radiofrequency ablations and all that stuff, or they wanted to try to avoid surgery and stuff like that. And so got trained in bone marrow aspiration and then eventually got trained in the small volume liposuction for the adipose tissue stem cell procedures.